The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗵𝗹 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗵𝗹. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗵𝗹 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗵𝗹, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
Ako po si Bernard Tan, ang kakampi.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗹. Indeed, you've got questions, we've got answers. I've got a bunch of questions for our doctor today. And we hope that this show uplifts your lifestyle and your health and gives you so much information that you may need in the future. And of course, that is my advocacy, to have a platform where we can talk to doctors, and those, especially doctors from 𝗏𝗏𝗵𝗹, who can give us the information that we need to live healthier and uplifting lifestyles. So today, folks, we are going to talk about childhood cancer, and our guest is Dr. 𝗂𝗛𝗟 Patricia D. 𝗂𝗏𝗵𝗹. Dr. 𝗂𝗏𝗵𝗹 is with us today to talk about this topic. Hi, Dr. 𝗂𝗏𝗵𝗹. Good afternoon. Well, it's afternoon here, but it's different times all over the world, and we have many people who listen from abroad, and they can also, of course, you guys know that you can watch the show anytime. It's online, and you can do that. It's on FB. It's on Radio Bandido TV, and you have all of and it's live right now on TV and radio. So how are you, Dr. 𝗂𝗏𝗵𝗹?
Hello, good afternoon, good day, good evening, wherever you are. Hi, Miss Nicole.
Okay. Thank you for being on the show today and sharing your knowledge with us. And thank you for giving us the time and effort to be here. So Dr. 𝗂𝗏𝗵𝗹, let's get to it. We're talking about childhood cancer today, and you are a pediatric oncology specialist. So, of course, you've seen this in your practice, because when we say pediatrics, it's for children, and oncology, it has to do with cancer. So you're the perfect resource person or resource speaker for us to get our knowledge from. When we talk about childhood cancer, Dr. 𝗂𝗏𝗵𝗹, is it a blanket term? I mean, there might be different types of cancers, but maybe we can circle back to that question of asking you what the different types are. Can I ask you, I guess what I'm asking is, when you say childhood cancer, what falls under it? Like, from what age? For example, from infancy to a certain age. Can you tell us when it's considered childhood cancer in terms of the age?
Yes, exactly. So we need to differentiate the different kinds of cancer, and specifically childhood cancer versus adult cancer, because their types are different, how they develop is different, the treatment per se is different. So in general term, but there are other certain cutoffs, but generally, like in the Philippines, childhood cancer would fall between 0 or even at birth to 18 years old. Once it's 18 days and 365, so it's 19 days, 19 years, adult na siya. But until 18 years to 364, it would still fall into childhood cancer.
Thank you for answering that, doctor, because of course many of us may have an image in our mind that, it's a younger child. And as you said, I'm glad we got that clear, that it's up to 18 or actually 19 years old. Once the person turns 19, then you'd have to treat it differently. You'd have to treat it as adult cancer. Is it like, if somebody, just a quick question, if somebody had childhood cancer and then they turn 19 and they're still undergoing treatment for cancer, or they still have cancer, do you start treating them like an adult already? Do you refer them to other oncologists, or do you still handle patients?
So generally, we have like a middle ground. We call it the AYA, adolescent and young adult group. So it's until up to at least age 24 to 25. But in general, like for example, we have started this particular patient into a certain protocol. Thinking about how if there are particular complications, etc., it's better to have a partner with a medical oncologist who you can transition the child into looking at, like for example, the certain length of therapy. If, for example, this particular patient would likely be continuing treatment for years to come, it's important that you endorse the medical oncologist. Sometimes patients, like for example, 19, if it's leukemia or like a sarcoma, they would want to stay with a pediatric oncologist. But most of the time, we partner with a medical oncologist if it's like a transitioning period already.
Thank you, doctor. I'm sure a lot of your patients like to stay with you because you've taken care of them since they were children and undergoing this, and even the parents. So, of course, you know the case. And I mean, even for normal things, like some of us were in our 30s and 40s and we still go to our pediatrician to ask, like, advice, like, what should I take? I have a sore throat. So, I mean, I'm sure, especially with this kind of care that you offer them and how involved you are, because this is a serious illness, very serious illness, that I'm glad you have this partnering up and having them transition, but you still guide your patients. Okay, so doctor, how does childhood cancer develop, or like can it develop in the womb already? How early can it develop? Can it develop during the pregnancy? And how early on can a child, or a person start developing cancer?
So cancer can actually develop anytime throughout the stages of development. Like we will be focusing on the pediatric age group, but it can be from womb, infancy, up until any time during the development. So, but luckily, the cancers that happen congenitally or in the womb, they do happen, and there are specific types of cancer that does that. The neuroblastoma, leukemia, germ cell tumor. Maybe we can discuss
Yeah,
that.
we can discuss the different types of childhood cancers now. And you know, as you're already started, like what happens in the womb, or just all types that you'd like to discuss and that you'd like to focus on. And let's get into that, and perhaps what you find most common in the patients you've seen in the Philippines.
Okay. So, going back to the initial question, when does it happen? So it can happen anytime. But in pediatrics, it's very important to take note of the age of the child, because there is specific prevalence per each period of development. So infancy, middle childhood, adolescent, etc. So the different kinds of cancer in children differs from that in adults. So pag adult, diba, it's usually the breast cancer, lung cancer, prostate. In pediatrics, the most common cancer is the leukemia. So we have the acute lymphocytic leukemia. That's the most common type of cancer. Almost about let's see, around 30 to 40% are ALL, luckily, because the prognosis is also good. And then we have the like a cousin of leukemia, the lymphomas. So it's a cancer that develops in the lymph nodes, or the B and T lymphocytes, which is part of a white blood cell, like leukemia. It's a blood malignancy. And then outside of the blood, what is common is the brain cancers, the brain tumors. For those, for the infancy, and then up until the early childhood, what can be possibly seen from the womb is what we call the neuroblastoma, which is a cancer coming out from the nerve sheets of the body. So it can happen anywhere, but it's common in the abdomen. Talking about abdominal cancer, differentials from neuroblastoma is the cancer in the kidneys, what we call Wilms tumor. It's also common in the Philippines. And the cancer that happens in the liver, we have the hepatoblastoma. And germ cell tumor, I think I've mentioned it earlier, not as common as in other parts of the country, but we've noticed that in in parts of Asia and in the Philippines, we see a lot of germ cell tumor. So germ cell is a type of cell which actually produces your reproductive organs, but something happens along the way that can happen in the muscles, and then osteosarcoma, the tumors that can be seen in the bones. So I think those are the usual cancer that we see in childhood.
Thank you, doctor. Can I ask you just a few questions around some of the things you mentioned? So, the types of cancer you mentioned. You mentioned that you see most of the time leukemia, and that can happen anytime, like whether it's the womb or in childhood. But you said there is a good prognosis for that. Meaning you can treat it in a better way. Like, children usually survive that, no? And then you mentioned lymphoma also, and you said it's the cousin of leukemia, and it's a white blood cell thing. It starts in the lymph nodes, but I just like the audience to I mean, please correct me if I'm wrong, just so that I can understand better. If it's the lymph nodes or lymphoma, is it the cousin of leukemia because the lymphatic system like circulates our blood around our body? So is that why it's considered the cousin of leukemia, also because it's a white blood cell thing? What happens with the white blood cells when it's lymphoma? Can I ask that question?
I just mentioned that it's cousin because it's like one group, like the hematolymphoid group
Blood.
of cells. But yeah, so it does really affect also your the lymph nodes. Specifically for lymphoma, it affects the nodes because there is some sort of change in your T and B lymphocytes. So the T and B lymphocytes, those are cells actually that are considered also as a white blood cell, and then they stay in the lymphoid areas. So those particular cells actually in a normal setting, they're responsible for our immunity and protection. In leukemia, just like in lymphoma, the manifestations are the same and more or less the same. That's why they're kind of like a cousin. It's very important to remember that, like for example, like in the blood, if it's a blood type of cancer, the manifestation can also be related to blood as well. So like for example, your leukemia, if for example there's a lot of like cancer cells in the bone marrow, so there's no more space for your bone marrow, which is like the factory in your body to produce your red blood cell, white blood cell, and then platelets. So in turn you will manifest with anemia, pallor, and then bruising or bleeding, and then frequent infections because your WBCs are compromised. In lymph, it's kind of like the same thing as well.
So your white blood cells are compromised, meaning they're not doing their job to protect you. Yet your immunity is lowered because they're supposed to protect you from illnesses, and then your lymph nodes also are supposed to catch. I mean, I'm just using like very common terms. It's complicated, but understand it, like they're supposed to catch this bacteria or disease and then kill it, but then they can't because your white blood cells are compromised, and then also the production of red blood cells, as you said, white blood cells and platelets, they're compromised. Okay, thank you, doctor. Just a couple more questions you mentioned. So I just want to make sure you mentioned that brain tumors are also common, and then you said there's tumors in the kidney that appear, also in the liver. And when we talk about germ, sorry, what was that term you used?
The germ cell tumors.
Can you tell us about that, more about that? It's interesting. So germ cell tumors, please jump in and correct me if I'm wrong. You said that germ cell tumors are cells that are supposed to help the child, no? Pwedeng fetus, pwedeng like any age, like develop their reproductive system. So that means like if the child is a female, it's supposed to help develop the reproductive system of the child. Doesn't mean the uterus includes all of that? If it's the uterus, the ovaries, I forgot what I have in my body, and then for males, it's maybe the prostate or the penis even.
Yes, yeah.
So what happens there when you have that? I mean, can you talk a little bit more about that? Because it's just very interesting for the audience to know. I don't think many people know that, especially, okay, so children are developing this kind of cancer. Just maybe an overview of what happens and how, it can affect the overall development of our reproductive systems.
So in general, germ cell tumor, so the germ cells specifically, they're normally present in all of us. So in I guess to make things simpler is that all our cells in our body are directed towards a particular task. And when cancer happens, the instruction in your body is different in such a way that it doesn't follow the correct path. So in germ cell tumor, the germ cells are like primordial cells in the body. So developmentally, they're there na. And then the primary instruction that is given to them is that, okay, germ cell, you are responsible to produce reproductive organs, etc. And something happened along the way, as in other type of cancer, that instructions tends to be different. It can be any sort of mutation, exposure to previous infection, or in embryogenesis, during the time that there is a particular
Hello?
instruction. Hello? Hello?
Hello, yeah. Hey, doctor. Okay, yeah, you're coming in clearer now. It just rained a little, I heard, and
Ah,
okay, so sorry. So you're talking about, yes. Go ahead, doctor.
there. So in germ cell tumor, these are the tumors that has different kinds. But yes, I think you mentioned it very correctly when you mentioned that in germs responsible for like reproductive organs. So that such that in germ cell tumor, the most common type is the gonadal germ cell tumor. So a germ cell tumor in your ovaries, in sa kids, in your testes. So they form into, fortunately, that's a mature type. We call it a teratoma. But sometimes we need to follow up these kids because there's such a thing as a malignant transformation. They transform into cancerous germ cell type of tumor that we need particular treatment after like the removal of the tumor. So yes, germ cell tumor is actually, it's really not something that is frequently talked about, but when we look at the prevalence or the type of cancer that we see in the Philippines, actually germ cell actually is way in the top 10 list.
Oh, okay. Okay. So I'm glad we talked about it here, doctor. I hope this serves as a platform for you to talk more about, these things, because we hardly hear about it. And just to get it see if I understand, of course, as with any cancer, like you were saying, these cells are primordial, like we're born with it, or as we're developing, they're already there, and they're supposed to, like, hey, you make the reproductive cells, you make the gonads and the testes and the penis, all of that. You make the uterus, the ovaries, and all of this. But what happens is something goes wrong, as you said, a mutation, and then they keep creating cells that they don't need, and they don't kill the malignant cells, or like there's no off switch, like they're
Yeah.
supposed to kill this and form that. So that's kind of what happens. And as you said, sometimes with the germ cell cancer, you'll see a baby born I guess something went wrong with the instructions, and it overproduced, and there's already a mass in the butt area.
Yeah.
Because I've heard that, like, oh, my baby was born with some kind of mass in the butt area, so I have to go back to the doctor. It's so that's why that happens, and it happens, I think, quite more often than people think, and they think, oh, it's just some kind of deformation, so it has to be removed. Yeah, especially in areas where they don't have great access or access to better health care. So thank you for explaining that, doctor. Sorry, what were you saying? I didn't mean to
Oh,
interrupt
yeah,
you.
that's true. Yeah. So sometimes these kids actually because they are classified as teratomas. So teratomas are generally benign. But
Mhm.
we've had cases wherein when we followed up the markers, there's a particular blood test that we follow up, rises following months to years after the removal of the tumor. And that particular patient would necessitate additional treatment
Mhm.
other than the removal of the tumor. So yes.
So thanks, doctor. We've gone a little bit into treatment, but we'll circle back to that later. Doctor, can I ask you, what causes childhood cancer, or what causes cancer in children to develop, whether it's from the womb or infancy, or as you said, there's a mid-child phase and then probably an adolescent phase. I mean, is it genetics? Is it familial? Is it exposure to something? What can cause it, and what often causes it?
So, in general, the answer to that is really it's still unknown, unfortunately, up until this time. It's not unlike adult cancer, wherein you know that there are certain risk factors, like the lifestyle factors or environmental exposure, like smoking, lifestyle factors that you can actually prevent. That's why what's difficult in childhood cancer is that we don't have a preventive campaign, because it's really something that can sporadically happen. Yes, there are certain types of cancer that can happen because of certain predisposition, like the genetic ones, but that's like the minority. So like
Yes.
less than 10%. So and we actually always mention this to family who has a child just recently diagnosed with cancer, because most of the time they feel that it's something that I
Yeah.
have done to prevent
Yeah.
this. Is it because I did not give my child vitamins, or things
Yes.
like that? So we always, at the very onset, we explain that most of the time cancer is secondary to a sporadic
Yeah.
mutation, meaning there can be like a particular exposure to
Mhm.
this or specific infection that sort of just turned on a switch, and then told your cells to, okay, make this instead of this. But really, we don't know. It's not something that, for the most part, it's not something that they can actually have a control of. It's really random mutation that affects the instruction of your cell to really do its role.
So, doctor, basically, can childhood cancer be prevented? It sounds like you answered the question. Can it be prevented? If you don't know what causes it, can it still be prevented somehow?
So it's the answers to that is a bit tricky for children.
Yes.
So it's
Yes.
really not something that you can prevent. I think more of prevention, it's the early diagnosis. So like, for example, for the less than 10% who has known cancer predisposition, or they have like in their genes a specific genes that make them more susceptible to cancer, that would be early monitoring so that we can diagnose early. But prevention per se, it's really difficult.
Okay. Thank you, doctor. And you mentioned quite a few things that, I really felt your compassion there. Because I asked you what causes it, and basically the answer is we don't know. It's unknown, and it's okay to say that, because we have had so many diseases and illnesses throughout history that, you have to study them. I mean,
Yes.
and as I can see I saw your compassion when parents say, like, did I do something to my kid? So, okay, it can be genetic. It may be genetic or familial, but your advice would be that it's not necessarily that you passed it on. I mean, whether it's the mother or the father, I mean, if it's in your family,
Hmm.
but you don't expect, maybe somebody has an adult cancer, like, say any adult cancer. It doesn't mean that just because they have cancer, you passed it on to your baby, because there are other factors. But as you said, it's sporadic, like it just happens, like randomly. There is something that causes a mutation in the genes of the child, whether the child is still in the womb or
Hmm.
growing up. it could be exposure to, I don't know, maybe doctor, that's why, when we hear about these cases where they sue people because apparently the water they were drinking in that land, like that can cause things, right? And then that's known, or the electricity. There's like, I mean, I'm talking about like basically cases not in this country, but and stuff you see in the movies. But but basically, I'm using it as an example to show that, oh, it wasn't the fault of the parents. Like the whole community got it, the kids. So it may be something like that, but we just don't know. And I guess what I really would like to thank you for assuring parents that it's not your fault. Like you said earlier, did I not give them enough vitamins? Did I not do this? I mean, so do you have also like a support group for that? I mean, you find parents or primary givers or primary caregivers of the children or guardians, like they must consult you a lot? Do you refer them also? There's a mental health situation here. Do you refer them to psychologists or psychiatrists, or you're the psychologist na rin and the
Most of the time, yes, for the entire family.
yeah.
But yeah, so it's really, really important to, at the start, that's really their first question. After you've explained to them the diagnosis, etc. Most of the time, the first question that comes out is that, is it my fault? Usually that's for the mom, especially if the
Absentee father. Yeah.
yes, or if the diagnosed child is usually toddler age or infant or baby, usually there's a guilt feel with the mom. Is this because I did not give something, etc. In terms of support group, most of the time, parents find it's very important because parents find comfort additionally with other parents as well. So there's really no like a formal support group for parents, but most of the time, each hospital they kind of bond with each other, and then they
Yeah.
find like support groups as well. They join Viber groups, etc., and they find um they find really comfort in discussing the same experiences, and then what the other parents or the other family did to surpass them. It's really important. Most of the time, there are times that I introduce like a family survivor with a newly diagnosed one, because it's really important to realize that there's
There's
most of the
hope.
time there's hope, and then there's light at the end of the tunnel.
That's fantastic, doctor. Like you, I mean, you intentionally introduce a parent who has a child who survived to the one that's newly diagnosed. I mean, some people just wouldn't care, like, bahala kayo kung ano dyan. But you introduce them so that they can see na, gumaling yung anak niya. Kaya, kaya to, especially if, I guess if it's a similar cancer, and they can help each other. Thank you, doctor. I'm really glad we have compassionate doctors like you, and parang ikaw na lang yung psychologist at psychiatrist ng buong family.
Yeah, but most of the time, like for example, it's very important that for like there are specific developmentally appropriate support for each. Like most of the time, there's such a thing as a specialty in pediatrics, the adolescent medicine. It's like there's a certain hospital who has
Yes.
specialty training for that. So such that it's a blanket referral. Most adolescent are referred to that particular adolescent cancer, are referred to adolescent medicine for co-management because of that. Because before, mental illness is not an issue. Just focus of, okay, cancer is more important than anything else. But we realize that you have to manage holistically all aspect of the child with cancer, so that the response to treatment is actually better, and also for the family. So for kids naman, there's such a thing as like play therapy or play support, so that sometimes they don't remember. The goal is so that when they recall, why was I in the hospital? Not the pokes, but more of, I was just playing there, or I have playmates in the form of like the residents, nurses, and we did a lot of coloring and things like that, so that they don't really remember, or they have a positive experience more than the negative experience of the cancer treatment.
So they don't always associate it with being poked, and they don't. I mean, it helps, no, with the also when you feel better about it, both the parents and the children. I mean, it does uplift you so that you can deal with the treatment and situation better, I suppose. I mean, do you find that as a doctor, scientifically, when they feel better, that they respond better to treatment? I mean, that's just that's a subjective question, but if you'd like to answer it, you can.
Yes, definitely. And it's really even scientifically proven that if you make the experience better for them, they tend to respond better. And most importantly, they do not abandon treatment, which is really the most important thing. Because sometimes when they feel like particular side effects of the treatment, they really don't want to continue treatment. And there are cases that happens like that. Very common. It's a very common scenario. In such a way that I don't want to continue treatment, or the kid really is traumatized going to the hospital just because of the painful experiences that they've experienced. So it's really part of cancer treatment to address the cancer and also address symptomatic relief, and at the same time be able to make the experience to them a little bit better, although we know that it kind of sucks.
Yeah, it kind of sucks, of course. Doctor, you mentioned symptomatic relief. Maybe you can tell us the symptoms that a child might have that are related to cancer, that a parent or guardian or primary giver, or even let's say a pediatrician, they normally take the child to who hasn't been referred to you yet. What are the symptoms that usually appear, and you can deal with it in any way you want, like if group it with different types of cancers. I mean, because it's a big like chunk to chew. If I ask you to give one by one, it's up to you, doctor. What are the basic symptoms?
Okay, so I'm wearing a gold ribbon right now because September is a Childhood Cancer Awareness Month. So it's very important. It's very important to be able to talk about this. And as we've alluded to earlier, childhood cancer is something that you can't prevent, but it's something that you can, if you have early awareness, you can diagnose early, and then the outcome is better. So I think I'll just circle back to the most common malignancy, because most of the time it's really what clinicians see outside of the oncology. So, for example, we have leukemia, so which is the most common type of cancer. The manifestations of childhood cancer is just like the usual, like viral infection, or the usual things that you actually consult your pediatricians for. But once they are persistent, they do not respond to the usual antibiotics, and there's really no other explanation for that. You have to consider the possibility of a cancer, of a malignancy. So for leukemia, as we've talked about earlier, if it's a combination of anemia, pallor, and then there might be, in addition to like red spots, bruising, or frequent infection, or bone pains, because leukemia is a problem in the bone marrow. So if there's really cancer in the bone marrow, chances are there's no more room for your cells in the body blood cells in the body to really produce, such that you have the manifestations of decreased red blood cell in the form of anemia, bruising, nose bleeding, gum bleeding, red spots, because your platelet is already decreased, and it can't make more platelets because the leukemic cells are occupying the space in the bone marrow. You have frequent infection because you've actually described it very well earlier, because the white blood cells, which are supposed to be like the soldiers in your body, is not really working, it can't support you because either the WBC are defective because they are transformed into leukemic cells, or they are low. And bone pains because since there's no more space in your bone marrow to produce your normal red blood cell, the tendency is that the uncontrollable production of your blasts of your leukemic cells, they go out of the bone marrow and go to other bones, so that there's really impact, and then that translate into bone pains. I've mentioned earlier, like lymphoma is a cousin of leukemia because they can manifest as well with big lymph nodes. So big lymph nodes, if it does not resolve with the usual course of antibiotics, if for example you were diagnosed first, your child was diagnosed first with having sort of an infection, but after like 2 rounds of antibiotics, there's still lymph nodes and it seems to be increasing, then you have to think of a possibility of leukemia or lymphoma because, again, going back to the bone marrow, if the space is already filled up with all those leukemic cells, with all those lymphoma cells, they try to find ways to produce or to house in, so such that the lymph nodes increases. Your extramedullary, is your outside bone marrow factories, so that your liver and your spleen also enlarges, so that also translate into big abdomen. So usually the kids that the usual scenario is that my child has been very pale for quite some time, and I noticed that there is a node that is growing, and then I also noticed that my child's tummy is actually growing. So those are signs of parang extramedullary activity because there's no more space in your bone marrow, so that the other cells, the leukemic cells,
Are going to different areas already and filling it up.
already. Yes. So I think those are the signs for leukemia. Additionally, for lymphoma, we have what we call the B symptoms. So it's unexplained weight loss, drenching night sweats, and fever. So if that is like you feel that on top of other things in combination, and then you have seek consult, you were given treatment for a particular infection, etc., and it's still not resolving, that you have to consider the possibility of lymphoma, especially for adolescent, because like the Hodgkin's lymphoma, that's usually the most common age group is the adolescent, and usually accompanies like a lymph node in the chest, so that when a combination of night sweats, drenching night sweats, because it's really hot in the Philippines, so drenching night sweats, fever, and weight loss, and then there's like sudden, you feel that you have shortness of breath, etc., and then you can palpate a lymph node, you have to go to your doctor. And then on the adolescent period, for example, for the for the abdominal tumors, so usually the age group would be any on the young ones, 5 years old and below, but actually, for parents, I would advise that anything palpable in the abdomen, you have to seek consult. You have to put cancer in the differential, no matter if the child looks really happy, benign, because Wilms tumor, the tumor in the kidneys, usually the average age group is around 3 to 5 years old. Usually it's the usual presentation is incidental finding of a parent while beating their child, and a happy child, etc. And then, wait a minute, parang I can feel a lump on the abdomen of my child, or on the flank area. So we have to make sure that it's not Wilms tumor. Retinoblastoma, which is a common malignancy in childhood, only found in childhood. There's the usual most common manifestation is the white eye, leukocoria, and actually most of the time, ang description of the family is like parang doll's eye, parang the eye of my child seems to be like parang cat's eye, yung description nila.
What's that?
Yeah, parang like that. But leukocoria, you can actually check. Like, di ba, when we take
Yeah.
pictures, and then there's a flash
Yeah.
photography. The usual is to see a red-orange reflex. Parang, nag-red everyone. But for example, you have like, if you notice a picture of your child and then it's white instead of the red, you have to show it to your pediatrician so that you can be referred to an ophthalmologist for checkup.
Sorry, go ahead.
Yes.
Okay, so doctor, that's great. You mentioned a lot and the symptoms, and you mentioned that retinal
Retinoblastoma.
retinoblastoma is only present in children, so adults don't get it. And
Yeah.
that's a great way to tell. I'm sure people take a lot of pictures of their babies, right? And then especially the firstborn, then when you get to the fourthborn, wala na, parang tatlo na lang yung nasa book. Pero they take a lot of pictures, and you said the usual thing. Okay, so it's like the eye is white. There's whiteness, and some people describe it as cat's eye. I'm just going through what you said, so the audience can sort of recall. Like, there are ways already that you can tell these are the symptoms, and you've done it in such a good way. You've described it. Usually there's flash and the eyes turn red or orange or something. But if your baby, or a kid that's between 3 to 5 years old, I think you said, is when it manifests. Please correct me if I'm wrong. Jump in anytime. Um, if it's white, then maybe you should consider it. And if you're looking at it and it's strange, so okay. And then when it comes to the stomach, basically the kidney tumors, and like other cancers that manifest in the smaller children, like they may be happy and lively, but like when you bathe them, oh, there's this thing, there's parang may bukol sa tiyan. We shouldn't just assume na taba lang yan, or kasi people like chubby babies and all of that. You should check it out and bring the baby to the pediatrician at least. Like, we don't just assume na okay lang yan, mawawala rin. Meron na yan dati. I've heard things na may bukol yan dati pero nawala, so okay lang. Pero bakit balik? And then you did mention earlier that your focus on leukemia and lymphoma, which is prevalent, as you said, in the Philippines. It's everyday things that you can notice as a parent. Your child has an infection, pero 2 beses na nag-treatment ng rounds ng antibiotic, as you said, and nothing has happened. And then there's frequent infections, and then of course they'll take the blood, so you'll see yung sa CBC, bakit mababa yung red blood cells niya. Tapos they say, your kid has anemia, because before, doctor, it was so common na child has anemia, so they'll just inject hemoglobin or some vitamin or something like that.
Yeah.
But with this, you notice, I mean, you should investigate further, or you ask your pediatrician. You have to consider it, as you said. You have to always put that in the equation. And then there's the symptoms are anemia, so that's low red blood cells. And you're saying that it can also manifest like biglang there's a lymph node that's swollen, because those cells, whether they're malignant or not, but the faulty white blood cells are trying to go to places to make space for us to develop blood. And it's the bone marrow that creates red blood cells and also white blood cells. So when it comes to diagnosis, doctor, you mentioned all these things. Maybe the focus on anemia and on leukemia. Then for the adolescents, you mentioned there's night sweats, there's fever, and as you said, it's very hot in the Philippines. But if you say, okay, nag-aircon na yan, but they're still drenching the bed sheets, you gave them already something to lower their fever. Kasi syempre, that's the first line of defense. But then the fever keeps coming back. Then they keep having infections. Tas may antibiotics na. That's a red flag already. How do you diagnose it exactly? Like, for example, for leukemia or the lymphoma, do you do like a bone marrow biopsy? I mean, how do you, even if it's just general, how do you diagnose like these cancers? What's the process?
Yeah, so
Sorry, I'm throwing a lot of questions at you.
You felt my but in general, like you need a tissue diagnosis to diagnose, to best diagnose. But there are it's but you don't really say, oh sige, cancer ka na right away.
Oo.
Yeah, there's always really a careful like history and physical examination. Does it really fit the criteria of a malignancy? And then it's really sequential. You do blood tests. Like for example, for leukemia, in the proper setting of like the history, and then when you do the physical exam, and then you look at as simple as a blood count, looking at, oh, the WBC is decrease, but there's really no setup for iron deficiency. As what you mentioned earlier, that the certain knee jerk is, okay, anemia, iron yung problema mo, bigyan kita ng iron supplementation. But if it really doesn't fit, the mom claims that the child has good appetite, etc., iron-rich foods, but the hemoglobin is unusually low, and then your WBC and leukemia can actually be super high, super low. And the platelet is low as well. And when you do your physical exam, you can palpate something. So that's the time. And then when you review the smear, you see like unusual looking cells. So that's the time that in a proper context, you do a bone marrow testing. So you get a blood sample from there, and then you just to look at what the cells, the bone marrow is actually, what type of cells your bone marrow is actually producing. There is a test that you can actually say if what kind of leukemia, if it's really leukemia, the specific type, and then what lineage they are, etc. For lymphoma and the rest of other malignancies, it's usually you get a sample from the most accessible part. So for example, lymphoma, the most accessible lymph node that you can get, and then you test that. You send it for pathology so that they can identify specifically what it is. But I think since we spent a lot of time in germ cell tumor actually they have a specific tumor markers, such that if it's elevated in the context now, you think because of the site, you feel that this is a germ cell tumor, you can order a particular tumor markers, and if it's elevated and then it follows the usual like the most common like clinical pattern, yes, so you can actually diagnose a germ cell tumor because from that. But
Thank you.
it's usually you get a tissue diagnosis. It's very important because there's a lot from the different types of cancer, there's a specific subtype pa. So you really need to get a tissue diagnosis.
Thank you, doctor. I'm sorry if I kind of jumped the gun, which is what actually some people do. Oh my God, we have to get to the tissue thing first. Basically, correct me if I'm wrong, what you're saying is, of course, a patient and the parent will consult with you, and then you'll examine things clinically. Like you'll give them a physical exam, you'll be able to palpate, you'll ask, okay, what are the symptoms that you notice? Okay, then you have to get the history, as you said. Sorry, I jumped the gun. And then and then you'll get blood tests, and then also a CBC will show white cell blood count, red cell blood count, hemoglobin, hematocrit. There's other types where you can check if it's anemia with the MCHM, whatever, I forgot na. And then like you said, the usual thing is, okay, so if it's anemia, we've been giving them the knee-jerk reaction is to give iron, but somehow it's not working. And then after all of that, I mean, who knows, it may work out, right? Whatever you prescribe. But after that, if it's still that way, that the most definitive thing is to get tissue or a sample, like either through the biopsy of the bone marrow, or a tissues for other cancers, a tissue sample of whatever the easiest thing is to get. Like if it's lymphoma, the lymph node, that's the easiest to get a sample from, and then you test it. you do smears, I mean, to pathology, and those are people who work, probably like underglorified people who work so hard on helping people diagnose. And also and then also you mentioned, we talked about the germ cell cancer quite a bit. With germ cell cancer, you were saying there is a specific tumor marker you can get. So that involves a blood test, yes? When you
So
do it,
there's
blood test. Okay, so like somebody whom you suspect may have a germ cell cancer, they'll go to you. Then you say, "Ah, it kind of fits the pattern." You're like a detective, no? I mean,
uh,
you have to know the truth. It kind of fits the pattern. So we should order this specific tumor marker test, and it's a blood test, and then it will check for the tumor marker. So, doctor, sometimes the reason why I go through the steps is so that patients don't freak out, or so they understand better. Like if they go, this is what's gonna happen first. It's not like they're gonna shove you into an oven right away. And I mean, it's okay. Thank you for explaining it so well. And you see, I had that same reaction where I jumped the gun. So do we need a biopsy? But you're like, no, relax, Nicole.
that's
Relax. Other
Ah, no, because sometimes there's really a stigma when, like for example, a child is referred to a pediatric oncologist, and I get that a lot. Pasok pa lang sa clinic parang teary-eyed na because they think that from the get-go we'll do invasive things already. But yes, but thank you for actually highlighting it, that it's really like a step-by-step process, and we usually guide the family why we want to do this, and this is the reason why we need to do this. We'll try to, as much as possible, identify first the particular type of malignancy if we really feel that it is a malignancy, and then guide them through the process para it's really not a certain shock. I feel for parents who actually, even the thought that their child is being considered as having a malignancy, it's really a bit daunting for them already. But yes, so it's really a stepwise process.
And like doctor, could be something like, I mean, just talking about anemia or leukemia, or I mean, if you checked everything out and then you also did a bone marrow biopsy, it turns out the person does not have cancer, or the child, in your case, it's a child, but the person doesn't have cancer, but they still have a certain type of anemia, then that can be treated also.
Mhm.
Right? I mean, they might have they might still exhibit the symptoms, but it could be like a certain type of anemia, or maybe they just need treatment. So not to freak out right away, because
Yes.
you're taking step by step. Okay, doctor. How does just very quickly, how does childhood cancer develop the growth? Um, and I mean, how does it affect the growth and develop? How does it affect the growth and development of the child? And you know, um, well, you've talked about the treatments already, but how does it develop? How does it affect the development and the growth of the child, and maybe perhaps even those taking care of the child? Does it slow the
Yeah.
child down? Mhm.
So I think the main effects, particularly with a child, is that of course it will disrupt how they socially interact with other people. Number one, they will miss a lot of school days. For leukemia, it's a treatment of 3 years, and I only clear leukemia ALL patients once they're on maintenance phase. So that's about 1.5 years, 1 year through the treatment. So there's a lot of certain effects like emotional, physical for some, and there are throughout the growth and development, there are long-term side effects already, also, and then you actually do surveillance up until they grow into adulthood, and up until you transition them to your adult counterparts. But what's good right now is that there is an increasing sort of awareness that childhood cancer, when you diagnose them early, when you detect them early, they get treated early, the complications are less, such that the effects in growth and development might be less as well. So there are specific effects, yes, but we try as much as possible to mitigate the complications by if you risk stratify them in such a way that they're like early stage, you give them the less intensive treatment, which will not affect the outcome of their child, and then late effects clinic and then survivorship clinic is actually more common right now, so that you really guide their development. The goal for us is that we just don't treat cancer. We make sure that they will become healthy adults in the future. I
That's
think,
great.
yeah.
I mean, sorry, I didn't mean to cut you off, but that's great, doctor. I mean, see, that's the thing. You're saving the child, because you mentioned earlier, a lot of people just don't want to come back, and it
Yeah.
becomes more difficult, and so that affects their growth and development in terms of emotional things. They miss out on school, maybe their interaction with people, but you do address it step by step and focus on early detection an early diagnosis, and it also helps have as you said, there are things that, because there's different kind of cancers, we can't be like totally specific, because we actually don't, we're out of time. But it will affect them for life, but you do transition them to someone who can then take care of them and see if another oncologist for adulthood, and then your goal is for them to survive. And of course, not everyone has the same kind of problems that they have, but everyone has to go through. Watches this show, he learns a lot. It doesn't freak him out. Maybe he'll be a comma doctor someday, I don't know. But you know, I'm not supposing that children are watching this show right now, but maybe people who know people, please use it as a platform. Is there anything you'd like to say, and anyone you'd like to say hi to or bye to or anything? Please, you have the floor.
So I guess first is thank you for giving us the platform to talk about childhood cancer, because most of the time it's such a boring topic, right? So nobody really wants to talk about it. But if at all, from someone watching this who has a child with a white reflex, a white leukocoria, or an abdominal mass that it's not going away, or a child with a combination of pallor or bruises, etc., who consulted a doctor because, hey, I think my child has cancer. It's really very important to, I think the final words is that there should always be an awareness that childhood cancer does really happen in children. Kids do have cancer too, and for kids, specifically for pediatric age group, the most important thing is that there is an early recognition, so that they get the treatment is less intensive, it's less toxic, and the outcomes are actually better. That's the only way that we can assure that the outcomes are good. It starts with early diagnosis.
Thank you, doctor. And you said, yeah, nobody wants to talk about it because it's so boring. I think maybe it's just a little scary, but you know, for people. But perhaps, doctor, you can come back on the show, and you know, if you'd like to talk about each type, I mean, and like dedicate each show to, or two types, you know, and dedicate that. Please, you're welcome to do so that we can raise more awareness, and we can like delve into it deeper. And thank you very much for being such an informative and gracious guest today. I'd really like to thank you and commend you for all the good work you do. Okay.
Thank you so much. Thank you so much. Good
Please
night.
come back anytime. Discuss anything you'd like. I'm sure you have so much more to say, and there's so much more to learn from you. Thank you, doctor. And anyway, folks, we are out of time. We're over time, in fact. Thank you, Kakampi Bernard Tan. Don't kill me. I took some of your time. Magkakampi naman tayo. Okay. So thank you, folks. Stay tuned for Kakampi Bernard Tan. He has a great show. He has great shows. He's a public servant with what he does on his show. Thank you, doctor, for being here. Thank you to the Makati Med team. Hey, Bernard. Okay, so thank you. And then thank you also for just thank you, doctor, and thank you to those who help people with their health issues all the time. So we'll see you next week on Healthline with Makati Med. I'm Nicole Jacinto, your host. We've been discussing childhood cancer with Dr. 𝗠𝗸𝗶, and stay tuned for Kakampi Bernard Tan. Bye, everybody. See you next week.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.